I'm one of the second-year fellows.
I'm Neil Cooper. I'm one of the PGY6 first-year vascular fellows.
I'm Amber Hussein, and I'm a first-year fellow in vascular surgery.
So coming out of residency, I did my training at a community program for general surgery. Our program was very proactive about getting us in the operating room, getting us early patient exposure. And I was looking for similar things when I was going through fellowship training programs. Geisinger fit the bill for that. Looking at the fellows that were graduating when I was interviewing, their case numbers compared to programs elsewhere were reflective of what I wanted to do coming out of after fellowship.
I'm from Pennsylvania region, so I got to move closer to family while getting a great education.
I did my residency training at Guthrie, and I heard a lot of good things about Geisinger, and we had rotated here when I was on pediatric surgery, and I really enjoyed the environment. I really enjoyed the facility, and it was much similar to my residency training except for on a larger scale. I think the group is great and we get along very well, and that was another factor.
I think the greatest thing about working in the vascular department is every day we come to work, you never know what you're going to do. Whether you're coming in and expecting to be in clinic, you end up in the operating room, or you end up doing some research. The day is always very exciting, and it makes our job what it is to be thrilling. And we all love our jobs, from the fellows to the staff. And if you were able to visit us in person, you'd be able to see that for yourself. But now you're able to tell it, hopefully, on these virtual interviews. The greatest thing about living in central Pennsylvania is there's no hassles getting back and forth to work. I love living in a rural area. I think the thing that makes it most interesting and exciting to me is all the fellows we've trained over the years. They're colleagues of the staff, and at the end of their 2 years here, they're our best friends, and they're amazing vascular surgeons. And I'm so proud of the end result.
The breadth of vascular surgery that we see here and the amount of exposure that we get from the very beginning. I feel like most of the general floor work is well handled by our resident support, which really lets us focus on learning how to operate and learning how to manage vascular patients.
The fellowship here at Geisinger stands out for a couple of reasons. We do an absolute ton of cases. Graduating fellows have had humongous case numbers. We do everything from bread and butter vascular surgery to the most complex vascular interventions throughout the entire gamut. We have probably the best crew of people that I've ever worked with, from the operating room staff to attendings who work in the most collegial manner possible, handing off cases, supporting each other, and lending advice to each other. Typical day for me here at Geisinger, I get into the hospital somewhere around 6:30 in the morning, and I see all of my post-operative and pre-operative patients before we have our morning run the list with the attendings at 7 o'clock. We have daily didactics that continue until about 8 o'clock, and then from there go directly to the operating room.
We have a conference, which typically includes some educational content daily. So whether it's case conference or M&M, followed by V-Score curriculum, as well as a vascular lab conference for the first hour in the morning from 7 to 8 a.m. And then pretty much we're in the operating room all day, which is great.
show us, please? Look at this. It's gonna go with the blooper reel at the end. There you are.